afternoon. Today we are going to discuss about unit 14, that is health and ICT. Coming to the contents of the unit, it is introduction, learning outcome, health sector and ICT, online health information and strategies. So, introducing the concept of health communication, we have to first understand what is health, that is the state of complete well-being, and that is the continuum of an individual from growth to the development of throughout the life. So, the role of ICT in communicating in health, that is we all know the messages have been transferring from individuals to individuals and from persons to person, from a society to individuals, from doctors to patients and to community health workers to society. So, how these messages has been transferring, that is there is a channels or media that is reaching to the audience. So, in all through the process the ICT is playing a critical role in communicating health messages. Health communication is the study and use of communication strategies to inform and influence individuals and communicating decisions that enhances the health. So, it may be verbal and written communication and may be media strategies, that is using different channels, television, radio, print or social media, that is to communicate messages. And when tracing through the history of health communication, it started and rooted through the development of communication itself, that is from the oral communication, from pamphlets to the written boards or signboards, and then to speeches, that is all the religious readers or the political campaigns or political leaders have been trying to communicate throughout the years. And later on it developed to the technology, that is the use of different media for communicating health messages. So, as we all know the sustainable development goal that we are going through the SDG era, health is mainly focused as the third goal, that is ensuring healthy lives and promoting well-being of all ages. Even though major progress have been attained, half the world population is still working without access to the essential health information and sources. So, promoting and protecting the health, that is our own health as well as the others, bringing awareness and quality to information is the main essential or the need of the SDG. So, somehow we know that we are having so many messages, so we are having the access to different media, but even though we are confused to select what media or what channel or through which medium. So, this is there arises the need for educating health, that is educating. The SDG is focusing upon mainly to the promotion of the well-being through all these aspects of the individuals. So, the main objective of the learning outcome, that is after reading this unit you should be able to understand the dynamics of health communication. So, how the health communication is happening and exploring the role of ICT in health communication, the role of ICT, that is information communication technology, the crucial role they are playing in our health sector, and what is e-health and the different sectors where e-health is working, explain about the strategies of health communications, health information literacy in the internet age. So, coming to the our unit, that is health and ICT. First of all, we have to go through the health communication. So, we have already said that health communication has been used and studied in various communication strategies, and it has been mainly aimed to inform and influence decisions and actions to improve health. So, how we can promote changes and create awareness, that if knowledge is there, how the needed or appropriate need can be created among the individuals. We all know that health communication is a behavioral change that is in the individual. So, different strategies have been adopted for the practice or the health communication. But however, the health communication term was first used in 1961, that is the National Health Council, they used it for the National Health Forum, that is to identify the challenges faced in the communication of the health information. We all know that there are different challenges that we are facing in the accessing of health information. In the risk perspective, it is the credibility, source and social and cultural aspect, quantity and quality of the informations. So, health and ICT, that is the unit where we are going to discuss. Health communication is the study and use of communication strategies to inform and influence decisions and actions, that is to improve health, promote changes and to create awareness and knowledge that is the needed and appropriate changes. So, the change here is the behavioral change that is among the individuals. Different strategies have been adopted for practice of health communication. However, it was in 1961 the National Health Council, that is the Health Forum of the National Health Council, used the term health communication, that is to explain the challenges faced in the communication of health information. We all know that there are different challenges that is facing in health communication: risk perspective, social and cultural problems, then the quantity and quality of information. However, it was in 1962 due to the development of various techniques of communication can be used to make health information available to the public. But later it was in 1997 the American Public Health Association recognized health communication as a discipline, that is the health communication need to be more studied and a research has to be undergone in different aspects, that is in developed, that is the American Public Health Association were more focusing, but later it has developed into developing nations, underdeveloped nations, among the vulnerable and the marginalized group of the society. Before understanding the need for health communication, we should focus upon the principles developed by WHO, that is World Health Organization, for underlying the need for health communication. So, World Health Organization have been identified certain principles such as accessible to the decision makers. That is, there are certain channels, but all these channels should be accessible to the decision makers. It should be actionable by decision makers, and credibility and trust of the perceived by the decision maker, as well as the understanding and timely understanding. So, from these principles of WHO, there arise the need for health communication, that is mainly focusing upon increasing the risk perception, reinforcing positive behaviors. We know that there are certain risks that is existing in our societies, maybe the access, maybe the social or cultural factors, that social determinants, maybe the many other factors, economic or social background, or whatever it is, or it needs to be reinforced these positive behaviors. Positive behaviors means we know that the superstitious beliefs we are facing. And again the influencing social norms, increasing the availability of support and needed service, and finally to empower individuals to change or improve their health conditions. So, coming to health IT, that is health information technology, we should understand that ICT is playing the crucial role in improving the health care, that is accessing, communicating and storing the health informations. So, in order to bridge the gap between these as they emerge in the health sector, there has to capacity to hold the informations. So, health information technology or health IT, the electronic systems the health professionals and patients use to store, share and health informations. That is, we know that developing countries and developed nations are facing different situations. That is, in developing countries, main problem arises when health care prevention and health care strategies or the status of the population. But in case of the developed nations, it is mainly the bridging the gap between the health sectors. So, in developing nations, the IT or the health information technology is playing a crucial role, that is an instrument for continuing education for the doctors as well as caretakers in training and informing, delivering a mechanism to the poor and remote locations. That is, wide variety of service has been provided to the remote area, mainly to the public health educations and for the emergencies, and also the potential use of a mechanism to increase the transparency and efficiency of governance. Online health information, ICT. Health and IT. The term health information technology refers to the use of electronic systems by the healthcare professionals, that is mainly the patients or the professionals, to store, share and analyze health informations. So, it depends upon the accessing, communicating as well as the storing of the informations. So, we identify that there is a bridge existing between that merging in the bridge that existing between in the health sector. So, in order to bridge the gap between the health sector, there need to the health information technology. So, it arises in the developed nations as well as developing nations. In developing countries, the main essential to healthcare prevention as well as the health status of the population. It is acting as an instrument for continuing education for doctors as well as caretakers in training and informing. Whereas the main delivery mechanism to poor and remote area, wide variety of services has been used as well as provided, and that is mainly to public health education as well as for the emergency advice. And coming to next, that is the potential use as a mechanism to increase the transparency and efficiency of governance. Health and health IT or health information technology mainly refers to the electronic systems that is used and the technological innovations that have greatly or improved the ability to access information, that is facilitate communication and improve efficiency in nearly all aspects of life. It mainly aimed to the public health information, that is the emerging as a front force, that is technological barrier to reach out to the diverse population. So, from health information technology or health IT, we come to forward to online health information, that is searching internet or depending upon the online source for health information. So, all of us have been turning on our internet source, whether computer or mobile phones, that is searching internet for different aspect of health information. We know that there is a complexity in information, that is the vast data is available in different forms. So, e-health, that is World Health Organization identified e-health as using ICT to support public health and healthcare areas. So, e-health means it is used to support ICT in different sectors. So, e-learning is essential for the network enabled transfer of the skill and knowledge. This depends upon the skill and knowledge of the individual who are depending upon these online sources. So, here in E does not only stand for the electronics, it implies the several sectors of the E's, that is describe the use of ICT to public and healthcare emergencies. So, e-health has been used in the field to intersection of the medical informations, not only in public health or not only as a technical development, but it is used as a state of mind, that is may of the local regions, that is using it in the locally and globally, that is using technology for this different aspect of health information. So, a state of mind of that is, it is not only of the e-health, that is the individual's efficiencies, that is one of the promises of e-health is to increase efficiency in healthcare. So, efficiency means we cannot gain, or it is a skill. So, the efficiency cannot be gained through a single step, it needs a different aspect of the E, that is evidence, educate, empowerment, encourage, enable, extend, ethics, equity and enhances. And finally, to entertainment, that is easy to use and to existing values. So, when we are describing all these sectors, that is efficiency in healthcare, we know that evidence based, that is effectiveness and efficiency cannot be assumed as an empower. So, it mainly aimed to the empowerment of consumers as well as patients, then encouragement, that is or the empowerment, then finally enabling information, that is exchange and communicating the way between the healthcare establishment. Then ethics, that is involved in the form of the poses the challenges and threat to the concerns we have to follow in the health information. Equity, to make healthcare to reach to everyone, that is the marginalized as well as the vulnerable group. So, discussing on the e-health and online health information, we all are familiar with the digital health sector in India, that is the digital health initiative that we have been gone through these years. That is to take up Digital India initiative, the Ministry of Health and Family Welfare started various e-government initiatives, and during the recent times, that is during the COVID-19 aspect, we have been depending upon this digital health in different aspects on telemedicine, conferences like that. That is, we are completely depending upon the digital health. We are getting the messages through mobile phones or our laptops or computer or whatever the source we are depending upon, and as well as the stakeholders, as well the consumers, the individuals, all are involved in this, that is communication technologies. It is making a world of difference from the direct communication. Strategies for health communication reflected to the materials, that is the old and the new technologies that have been used in the ICT sector, that is used in the health sector, for that is with the help of ICT aid. So, it not only included the internet as for delivering the content and that was traditionally used, and the traditional medium as print, radio or television that we have been focusing upon. The gathered health information through ICT for development discourse as well as the process of communication have been undergoing severe changes from time to time due to this technological development. And from this aspect we can discuss the new terms or the new concept of the health literacy, health information literacy and information dissemination. Health literacy, it is the concept that is representing the cognitive and social skills which determine the motivation and ability of individuals to gain access, to understand and use information in ways which promote and maintain good health. This is the definition provided by the World Health Organizations. So, from this definition of World Health Organization itself we can understand what it aims to, that is it is defined as the skill that is attained by an individual, that is the cognitive skill to determine the motivation and ability to gain access, to understand and use information. We know that due to the technological development we are completely depending upon these sources for the informations. And health information literacy is defined by Medical Lab Association as the ability to recognize a need for health information, that is to know how, where to find health information and how to evaluate and use this information in everyday life to make right health decisions. So, the different sources are identified or different information have been collected, but how to evaluate and use this information in everyday life, that is from the transfer from health literacy to health information literacy, technology is given more important because the source of information is having a crucial role, because we are completely evaluating and use this informations. So, from this information literacy we are transmitting it as an information dissemination. So, whoever the individual or the community or the caretakers who has collected the health information, they are transmitting it as information dissemination. Perspective of health information. So, we have already discussed the source and need for identifying the source of health information. From the perspective of the health information, it is essential to explain who are the different perspective of health information, who all are trying to communicate the health information. We know that already there is a different organizations and individuals, media campaignings are there, different sectors we are seeing and different areas and different concepts we are identifying the health information. So, how these health information have been disseminating? So, government organizations, civil society, community and political leaders, even the academic and the research organization is trying to communicate the health messages. So, in this organizations, government plays a crucial role in imparting health information, that is health literacy through promoting the policies, funding and the research that is going on through government organizations, medical organization as well as the populations, so that the vulnerable populations are empowered in itself. So, to make health promoting actions, whether to prevent the acute conditions and chronic illness, government is providing active intersections programs and campaigns. Government agencies and institutions, advocacies as well as the groups and media organizations are undergoing different target audience, that is to train the individuals as well as to educate the individuals. So, individuals here refers to the most fundamental target for health communication, since it is the individual behavior that need to be changed. That is, if the main when we have been discussing the sustainable development goal, we have already said that health communication not only aim to explain the skill that of an individual attained through his life, that is to communicate to others. So, individuals plays a crucial role, that is the individual self efficacy and the behavioral change. So, we know that when we are having a risk reduction as well as testing, effective way to change the protective health of the society is essential. Then coming to media, we are identified or we are having a rich source of media, that is radio, television, newspaper, magazines. then face-to-face communication through different channels, then members of healthcare facilities, then also listen to the public service advertisement, billboards that we have been gone through the different papers and others. The broad range starting from, moreover in rural areas still public announcements are being going on. Then when during this COVID-19 we have been witnessing the how the media is trying to educate the individuals through different aspects, how the organizations are involved, how the government have been educating, how the campaign, different sectors of campaigns are undergone. So we know that on April 7th it is identified as the world's most extensive communication program was launched in India, that is Swachh Bharat, that is to program in telecasted through the Doordarshan, that is mainly covering the educate the individuals or the educate the health information. So educating and enhancing the individual is the main target of all these campaigns. Next is intermediaries, that is community health workers, who are trying to link the gap, that is the community health workers who are identified as the intermediaries working with the government as well as the individuals. So when we are explaining the intermediaries, so intermediaries or community health workers are identified as the persons who are bridging the gap between the individuals to the government, public policies or whoever, whatever it is. So coming to India is having the largest sector of community health workers with Anganwadi workers, ANM and ASHA workers. So community health workers has been implemented in India from 1950 onwards, that is widely accepted and marked the changes under the ICDS program, Integrated Child Development Programs, that is, and again auxiliary midwife, the ANM, who was visiting in the villages to, in addition to providing care to the maternal and child care. Then ASHA workers, that is in 2006 India implemented ASHA, aggregated social health activist and one of the critical component of the health mission. So they are the female, all these have been identified as the female health workers, even though the male health scheme was started in India, it has been stopped earlier itself. So these health workers or the health workers are traveling from the villages to the rural areas to the different sectors of our society, communicating health messages, training the individuals, providing the basic health care and explaining the vaccination programs, maternal health care and child health development. So we have been discussing upon the different concept of health communication, what is the need for ICT in health communication, e-health, strategies of health communication, that is the health literacy and health information literacy, the source we have been identified, the information dissemination and the role of media as well as the how the different perspective of the health communication take place in the society. Thank you.